Thank you for joining me, Dr. Wong, and have more knowledge about the COVID-19 because I'm sure right now everybody's everything's so scattered. The news is saying one thing, people are saying another, social media is saying something else.
Yes.
I really just want to be able to speak to you because I know that you're part of the project that CircleDNA is doing called Project Screen, which is bringing more home testing available in Hong Kong right now. Okay, so one of the questions is, what is the difference between COVID-19 and SARS or the flu at the moment right now? I mean, we know that it's...
Yeah.
That is a really good questions. Good questions. You know, for the seasonal flu, actually the community had reasonable immunity, and this disease is not that deadly. The mortality rate is like less than it's like 0.1%, and then we get specific treatment for the seasonal flu, and also we get the vaccine. So comparing seasonal flu and SARS and COVID-19 is totally different, right? And then for COVID-19, I can mention that it is a new disease. Actually, we are learning every day. You know, the evidence one day ago can be different from evidence one day later. So we need to have an open-minded, right? But when we compare the case load, during the SARS episode, actually the total number over the world is like 8,000, right? The mortality is like less than 800. But nowadays, we already have 2.6 million of cases of COVID-19. So significant difference. And the mortality is like nearly 180,000. It takes 180,000 lives. So very severe. When comparing these two diseases, actually, when we talk about the case fatality rate, actually for the SARS is quite severe. It's like 10%. You know, up till now, the case fatality rate for the COVID-19 is like 7%, a little bit less than SARS. However, you know, the COVID-19 seems to be very infectious, very infectious. And one phenomenon that we are worrying about was that actually many people get infected and they remained asymptomatic. That means that they remain asymptomatic. It is difficult to catch these patients and isolate them so that it will spread all over the world.
This question. Yeah, so what is your take on the mask situation right now? Do the masks really work?
Yeah, I think masks is definitely very important. I will wear a mask every day, at least in the coming years. Because, you know, the COVID-19, the SARS, the seasonal flu, they are all viral infection transmitted by droplets. By droplets. That means that when we are talking, there can be droplets going out. When we are coughing or sneezing, there would be significant droplets coughing out. So that when the droplets, when the infected person's droplets contact another person's mucosal membrane, for example, nose, for example, eye, then this virus can go into the body of the other person. So that if you wear a mask, no matter what type of mask, surgical mask that is very good, N95 that is even a higher level, but that should not be the mask wear by the general population, should be left to the medical personnel. They are at a very high risk. And even if you had a DIY mask, that is not a surgical mask, is already good enough. So wearing mask is very important for this disease because it is droplet transmission.
So it's a droplet transmission, not airborne, right?
Yeah, it is not airborne. This is very important because, for airborne, airborne means there is ultra small droplets right there, and these droplets can flow in the air even after you are coughing, sneezing, after maybe 15 minutes in the room, there are small particles right there. So another person going in, they can be infected, right? But for droplet transmission is not as aggressive as the airborne, because when we are talking, when we cough or sneeze, the bigger droplets actually would travel for a distance, then they would fall down to the ground. So that people coming in afterwards, they are less likely to be infected. So difference. Airborne is
What about wearing goggles and like gloves and all of that stuff?
Yeah, for goggle is a good idea. If you can do that, you feel comfortable because one way of the transmission is those droplets can contact your mucosal membrane at your eyes and then leading to infection. So it is optimum if you can wear a goggle. But I mean the priority is for a mask, even a DIY mask. That is a good idea.
Some predict that as the summer approaches, the heat might kill off the virus. What do you think about this?
Yeah, that is a reasonable guess. For those seasonal viral infections, actually, these viruses are not doing well in the higher temperature, higher humidity in general. However, there are many studies showing that for COVID-19, it may not be the case. So we cannot count on that. So I would expect when the summer is coming, the COVID-19 won't go away, just like in those common seasonal viral infections. And you can see that now in Singapore, in Thailand, actually the temperature is quite high and they also have significant cases.
There's a question I think is pretty interesting is Alicia Ding is asking, are our chances of contracting COVID-19 multiplied whenever we order takeouts or get food delivery?
Now the weight of business for the restaurants are takeaway, right? Because we all think that going to the restaurants are a little bit dangerous. That is also true if there are outbreaks still in the city. So for takeaway, I mean, I presume the food are clean, right? Hopefully, right? And then there are still chances that some asymptomatic infected people or people are infected who had mild symptoms who are still going to work because they don't get adequate testing. They can cough and then the droplets can land on the package of the takeaway food, so that when we hand over this and then we touch our eyes, our nose, then we can get infected. So good hand washing, that is a very good idea. So another question was that whether this COVID-19 can be transmitted by the oral fecal route like the hepatitis A. So far, most of the specialists don't think COVID-19 can be transmitted by the oral fecal route. Okay.
By food or?
Yeah, by food. For example, contaminated food.
So if I just but what if I cough on the food?
I mean, there is always possibility. For example, if the foods are contaminated and then you touch the food, you take the food, then you may touch your face, then you can get the risk of being transmitted,
But not eating it?
Yeah, there is no evidence, there is no concrete evidence that the disease can be transmitted by the fecal-oral route, right? This is the current consensus. I mean, I'm always open-minded because, every day, maybe after 1 month, there are more data concerning this, the rate of transmission by the oral fecal route are established. But I can tell you so far, most of the specialists don't think this is a way to transmit the virus.
What do you think is the biggest misconception of COVID-19 right now?
Okay. So the first thing I think was that initially some people think that the COVID-19 is transmitted by airborne, So this is not true, so that, at the very beginning, people had, everybody would try to buy those face masks, those N95s that would decrease the supply to the medical personnel. So this is not true. In some particular situations which can make COVID-19 transmitted like airborne, that is in the hospital setting. For example, in the isolation ward, doctors are taking care of the COVID-19 patients, and then they may be resuscitating the patients because the patients had difficulty breathing. They are using the high pressure suction, they are using those nebulizing machine, and then in this situation, COVID-19 can behave as airborne. So, for the medical personnel, we are advised that all these medical personnel should wear the N95, more higher level protection that can protect against airborne transmission. But in the community, there is no indication for N95. The second thing I can think about was some people would think the disease is associated with some ethnicity. For example, Chinese people would have this virus, but not other countries' people. So this is not a good idea. This is not true because the virus infects people from all over the world. So this is important, very important message. And some really funny one was that some people think about the infection can be transmitted by the high technology 5G. That is really funny. Some people are burning up the 5G stations.
I don't know. I might be a skeptic on that. No, I'm just kidding.
Yeah. Yeah.
It's interesting where everybody's taking this. But I kind of want to touch base on the airborne again real quick in the sense of if I'm coughing, but then there's still that distance of the system.
Yeah.
People say it goes longer or it just stays there for, or does it, if I cough in this area, does it stay in the air or does it just go boom and then all of a sudden it just drops to the floor?
So this is a very good question and I would like to clarify that. So I would think no distance is 100% safe, right? It's no definite distance. Why people are saying 6 feet or saying, for example, 1.5 to 2 meters, that is a rationale. Because for droplet transmission, actually when we are talking, when we are trying to eating, there can be some respiratory droplets coming out from our mouth or our nose. For the droplet transmission, usually if we allow 2 meters, the droplets means bigger drops, so that within these 2 meters they may land on the ground, so that the people at more than 2 meters should be safe. But when you think about if I sneeze or if I cough, the pressure is really high, these 2 meters are not safe, right? So that means that these 2 meters is only safe if the people are not coughing or sneezing. If the people are coughing and sneezing, definitely you need extra protection. That is some sort of shielding, right? Face mask, surgical, non-surgical, they can help. So this, I would say, is around 2 meters is the general accepted precaution for social distancing.
Wow. Then the perception of how long it lasts on plastic and paper. And steel.
So this virus is quite tough, right? They can in good environment for them, for example, it's a very smooth metallic or plastic surface. If the humidity is low and if the temperature is not high, they can survive over days. Long time, so it would be really very dangerous when we touch the surface contaminated with the virus and then we accidentally touch our face, particularly the eye, nose, then we can be infected. So this implies we need to have very good hand hygiene.
So how long do you think it's going to take until we actually get a vaccine going? Because everybody's saying it's going to take another 18 months.
Vaccine is always very important in infectious disease. Normally, in developing vaccine, they need to have a phase 1, phase 2, phase 3 test that usually takes several years, But the world is, all over the world is working hard on the COVID-19. I would expect this process would be sooner than several years. Now there are many companies already exploring or investigating to develop this vaccine, and actually human study had been started for the efficacy and for the safety of these vaccines. So I would expect at least it takes 1 more year to have the vaccines to be available to the general population. For example, the timing would be at the end of next year. However, because there are still obstacles in developing the vaccines because there are significant mutations documented in the COVID-19, so that these mutations would pose significant effect on the development of the vaccine. For example, you develop one vaccine that is useful for the current strain of coronavirus, and then 1 year later there is some mutation and which would decrease the immunogenicity for the vaccine. Then you need to start again. So it's a difficult way to develop the vaccine, but we are all working hard on this.
Okay. And so what does it actually mean then when somebody is tested positive?
Okay, it depends on the method of testing. For example, the gold standard testing now we are using the RT-PCR method. That is a molecular method detecting the RNA of this virus. So it's a very direct test. If you are test positive, we will confirm the test. If you are positive, that you are infected with COVID-19, right? And you are presumed to be infectious. You are presumed to be infectious until proven otherwise. So it's very accurate diagnosis.
And then, so what if someone tests negative? What is the possibility of false negative?
Oh yeah. The possibility is that you are not being infected by the virus if you get no symptoms. It is first possibility, but there can be false negative. There are two major reasons for the false negative. The first reason was that you are being infected, but at a very early age, so that the viral load inside your body is still very low, so that the viral load in the collected specimen actually is too low to be detected. Maybe after several days, if you retest again, you will be positive. So that is the one possibility is due to the low viral load in early infection. The second possibility, the second possibility is that is the process of the specimen collection. For example, if you would like to collect a deep throat saliva, you need to collect that in the morning without brushing your teeth, drinking any water. Actually, if I drink a lot of water, then I proceed for the collection, then this specimen may not be reliable, so it can create a false negative test.
So even after the 2 weeks incubation period, there's still a possibility of it coming back. Or even if you heal if your body regenerates and your immune system beats it, but then you're still a possibility to infect other people as well.
So what I'm going to say was that in general, if the patient is infected with COVID-19, actually some form of immunity would develop, so that there would be some protection for this patient to get the COVID-19 against. But you know, because this is a new viral infection, we are not sure the level of the protection, whether it is 100%, 80%, so it is not sure, right? And then we are also not sure about the duration of the protection. For example, if there is an immunity, it can last for maybe several months or several years. We don't have any data. So that it's not a good idea to presume if a patient recovers from COVID-19, they are resistant to COVID-19. It's not a good idea to presume this, right?
Right. It's just like if I get the flu this year and I'm okay, but next year
yeah.
I get the flu again. And
yeah, definitely. And taking into consideration of many new mutations of this virus is very clever, you know. We cannot presume if we are being infected once, then we are resistant to the COVID-19 or coronavirus. We are Superman, we do not need to wear masks, we do not need to wash our hands. That is not a good idea.
Yeah, it seems like it's going to be a while until all of this clears, like, you know, for us to really go back to not wearing masks and all of that. It's pretty effed up. So ultimately, right now, we were just talking about how, you know, we've had a lot of questions about the COVID-19 and you know, it goes on and back and forth, but at the end of the day, right now, it just seems like the most important thing for everybody to do is to, of course, keep their immune system up and stay healthy, have proper hygiene, you know, social distancing and all of that stuff. But one thing that's really important is the COVID-19 test. And I just wanted to talk to you more about that, because I know right now we're developing a program initiative to actually inject more testings into the home environment. Is that correct?
Yes. Firstly, Ben, so I just want to say, very appreciative. I've been looking at the engagement just on IG now. There's so many great engagement from people, thanking you yourself, and certainly appreciate you spreading this to the community, because I think there is a lot of misconception in the community, right? And certainly, as you mentioned, for CircleDNA, and certainly Ben's been an early supporter from day one in terms of utilizing your influence to spread the word about the value of prevention, right? So I think that's key. So super excited. As I told you last week, we launched Project Screen in Hong Kong as a duty of responsibility. We felt we were one of the only companies in Hong Kong that actually could do this in a private sector, which was basically increase the accessibility of testing. So we did it as a nonprofit initiative. So individuals can basically order online, get their test kit in the next day, receive the test kit back to our laboratory. In 24 hours, you get your test results back. Because the challenge is around the world, lack of testing. Or even if there is testing, how do you make it easy? So that's the goal that we wanted to provide here to the community here in Hong Kong. We also worked with 8 other companies to do this. Prudential, HPA Social, Exelon, NGOs such as Tonghua Group, hospitals. So certainly it's been a great response thus far.
That's really, really cool, man. I'm really excited to hear that. So the test kits, when they come, is it just like the DNA test kits where it's just the swab, or does it go more, like the other ones where they take the tube down the nose and all that stuff? Like how?
Yeah, so I will show you how it actually works. So what we wanted to do is develop something that was quite easy and accurate, right? I think a lot of times when you do have the nose swabs, it's actually quite painful. And people actually, it's not a pleasant experience. Even when you do the throat swab, it's also quite difficult because you may not be able to get the right method. So what we developed we made it actually a deep throat saliva sample. Correct? So basically in the morning when you wake up, this is where you actually get the sputum from the deep throat. So it's actually easy and also less infectious as well. Right? So certainly we made the whole protocol very easy.
Wow. So, and then that right now, when is that actually going to be available to the people in Hong Kong at the moment?
So we started offering this last Wednesday. So certainly we've already been shipping the kits out. Individuals love it. Employers are actually joining up as well, right? So companies, for example, just last night we just confirmed Deliveroo will be testing the riders for COVID-19 testing, because certainly they want to protect their riders, and the riders want to make sure they're protecting the consumers and certainly with their families, right? We're also working with NGOs such as Tonghua Group, in which we had a separate donation in which they're providing 500 test kits to medical workers. And then so that's great. And Prudential is also subsidizing $300 HKD for any healthcare worker and their families in Hong Kong. So the price of our tests, if you're a healthcare worker or family, is basically around 90 USD. And then certainly if you're individual-wise, it's 125 USD. So there's zero profits. We're just doing this as a sense of responsibility to help the community tackle COVID-19.
That's awesome, man. Now, I know right now it's only for Hong Kong, but is there a possibility where you guys can expand, and do you see that expansion happening? What type of time frame?
Yeah, so right now we are quite focused on right now we are quite focused on Hong Kong and basically helping the community.
Of course.
Given that our laboratory is here, the headquarters is here. So certainly in time we'll look in terms of expanding possibly to other countries. Certainly this will be within the next few months, possibly. But certainly our main focus right now is for Hong Kong and neighboring countries. So certainly this is very important.
I see. So right now, well, would you guys, if there was like a possibility of like, if I ordered X amount, right? I'm not saying for just like me and my family, whatever, but like if I ordered X amount and shipped it to like the frontliners, would you guys be able to do something like that? I'm just curious as but then it would take a while because they would have to mail it back to you guys.
Correct. One of the challenges would be the logistic aspect, because basically right now when we get the deep throat saliva sample, it comes back to our laboratory in Hong Kong the same day. And then the next day, individuals, we release the results on the digital perspective, right? We also provide a registered medical professional to give you your results and go through it if you are positive. So we want to make sure everyone actually has the adequate information they need.
Okay. Well, I mean, it's definitely exciting stuff, and I'm really glad that, I'm blessed to be a part of this whole project, from the beginning, from CircleDNA and everything that you're doing. Thank you for all that you've been doing, Danny. And is there anything else that you want to add in to let everybody know what else they can do during this time?
Yeah, sure. Thank you, Van, for your support and everything from day one, right? I think right now is really the time to actually have many people come together. Right? I think that's the only way we will fight COVID-19 is actually having a joint effort. Yourself, myself, the public sector, the private sector, there's a lot of people that's going to have disagreements about whatever life we know is today, right? But I think when we look at this whole situation, hopefully we can think about what's truly important, and that is about coming together to fight COVID-19. So certainly, thank you. I think everyone's hopefully stay safe, stay healthy. Definitely wear masks, practice hygiene. Certainly, I think we've been able to do that quite effectively here in Hong Kong, and etc. And certainly, again, thanks so much for the support. I think the more we spread about this, about fighting it together, is the thing that will ultimately win.